We are now in the second to the last topic for this semester, and this week we will be discussing about the trends and issues in spiritual care nursing. Migration and cultural diversity are factors that influence the current trends in spiritual care. Technological and transportation advancement, wars, natural calamities, and job opportunities bring more and more people from different cultures together. In giving nursing care, it is important to consider the patient's beliefs because beliefs about healthcare are based in part on knowledge and are often related to religious beliefs. Culture is a powerful influence on how nurses and clients interpret and respond to healthcare. It is expected that a nurse from one culture should be able to give culturally competent care to patients from other cultures. Let us look into this practical example from Seattle Children's Hospital in the United States. The hospital offers 24-hour spiritual care services to patients, which includes 24-hour confidential care, care and support during times of illness, injury, crisis, or loss, and rituals such as baptisms, communion, blessing, and anointing. The hospital also assists patients in contacting their faith community, minister, priest, or rabbi, consultation with a healthcare team, and provision of inspirational books and CDs. Spiritual care services also include bereavement support and counseling, chapel and meditation room that is available 24 hours a day for prayer, reflection, and meditation, and various spiritual resources such as prayer book, prayer rugs, head coverings, and a variety of sacred texts. The hospital also provides opportunities for interfaith worship, celebration, learning, and reflection, such as Catholic Mass every Wednesday, meditation every Thursday, and multi-faith holiday services and special events. In this hospital, patients, families, and as well as staff are encouraged to utilize the 24-hour spiritual care service of the hospital. They may use this when they feel afraid, guilty, weak, discouraged, sad, or lonely, if they have a hard time coping, or they want to talk about the meaning or purpose of life. The hospital encourages patients, family, and staff to share about spirituality as their source of strength and meaning. If they're struggling with faith or religious beliefs, maybe some good news to talk about major decisions, or when they just want someone to listen. As you have noticed, the spiritual care services are designed to meet the needs of patients from different faith backgrounds. To prepare nurses to provide spiritual care in different practice settings, spiritual care is now included in the nursing education curriculum. It is now widely recognized that faith and spirituality provide important coping resources in times of illness and stress, and unmet sacred needs have been linked with reduced quality of life, value of life, and patients' contentment with care, and patients appeal to have their spiritual needs met. However, many nurses consider themselves underprepared to meet the spiritual needs of their client. Research have shown that nurses' abilities to relate to spiritual care are weak due to poor role preparation in nursing instruction or education. Nursing students can be prepared through education to be mindful of spiritual cues and proceed with patient-centered conversations when appropriate. The formation process of nurses should include spiritual care in the curricula. In the first part of this course, you were asked to perform spiritual assessment on yourself. Have you ever wondered why? It is because self-reflection activities give students the opportunity to be more attentive of their own spirituality and the quality of their nursing practice. It is important for you to know yourself because the greatest predictor of the student's aptitude to provide spiritual care is the perception of their own spirituality. Another trend that has gained popularity in the recent years is faith community or congregational nursing. Before 2005, faith community nursing is known as parish nursing. Faith community nursing is rooted in Judeo-Christian tradition and the historic practice of professional nursing and is consistent with the basic assumptions of many faiths that we care for self and others as an expression of God's love. In understanding faith community nursing, it is important to understand what faith community means. A faith community is a group of people who maintain routine fellowship to share their common history, values, and beliefs around their relationship with a higher power. The term faith community was adopted to recognize different types of faith. It focuses on health promotion, health screening, and disease prevention. It includes a more intentional use of spiritual and religious practices, and the faith community nurse utilizes the regular gathering of faith communities to develop caring and trusting relationships with their congregation. Faith community nursing is a recognized area of nursing practice in some countries, such as the United States. Faith community nursing practitioners should fulfill specific requirements to practice faith community nursing. Some of the requirements include excellent communication skills, organizing skills, and assessment skills, current license as a registered nurse in the state where the congregation is located, 5 years of clinical nursing experience, should be able to work well independently and can function as part of a team, and has good understanding of spirituality and religiosity. I look forward to seeing you all in class and that we would have meaningful sharing about the trends and issues that you have discovered.